Bismillah ar-Rahman ar-Rahim wa salat ala Muhammad wa ali Muhammad. Our lecture today is on hyperlipidemia, the most important lecture. Today is a Sunday, 6th of August, 23. The first question, what is the most common global causes of death or cause of death? The most common cause of death globally all over the universe is ischemic heart disease by partly abnormal lipids, a high lipid, partly by a high lipid, abnormal high lipid. The second question, what is the most common cause of death in USA? Is a CVA is the most common cause of death in USA. And this CVA is going to be the commonest cause of death in the universe in the next 10 years. Question number 3, is cholesterol important for the human body? Yes, it's very important actually. And which organ in the body produce or manufacture cholesterol? Cholesterol produced by the liver. The low density cholesterol, the triglyceride, all these produced by the liver. In about 85% of the need of the body. And 15%, the rest of 15%, we take it from foods. Why is cholesterol important in the body? Because all the cell wall of our cells, which are many thousands, مليارات الخلايا, all the wall is from cholesterol. All the vessel wall is composed of cholesterol mainly. Sex hormone is mainly from cholesterol, and vitamin D is cholesterol. Therefore, it is very important. The lipids are very important to the human being. Question number 4, at which organ in the body triglyceride manufactured? A triglyceride, which is the energy, which is the first part of the lipid to be taken by the muscle for energy, is manufactured in the liver. And it carries amino acid and used by the body as an energy, where it is the most important energy for the muscle. Where this triglyceride is being used, is more used with exercise, with the walk, with the jogging, with the swimming, with all exercise. Question number 5, how these lipids are carried in the blood? Lipid alone is non-soluble and precipitated in the blood and cause a lot of damage. Obstruction causes of this vessel. Therefore, the body will form a special protein, lipoprotein. It united with the cholesterol and becomes soluble and can be carried by blood. These protein are called lipoprotein cholesterol. And in this way, these lipids are carried as a soluble substance in the blood. Which lipoprotein considered to be the largest one? The largest lipoprotein is chylomicron, and chylomicron produced by the intestine. It manufactured by the intestine. Question number 7, high density lipoprotein. Where it produced? which organ produce high density lipoprotein? Actually, high density lipoprotein is a side after uses of triglyceride for energy. We get a side product is called high density lipoprotein. Therefore, a high density lipoprotein, which is the best cholesterol, is not evil cholesterol. This cholesterol is for health. A high density H, there is H in a high density, therefore it is for health. While low density, low health. Therefore, it produces high density, cholesterol produced by the exercise, by the using of triglyceride, and from that triglyceride burning for energy, we get high density lipoprotein. Therefore, walking, exercise, swimming, jogging, all these causing a high density lipoprotein cholesterol, which is good, which is healthy. Its action is actually taking the low density lipoprotein from the wall of the blood vessel and take it away. The eighth question in this lecture: does intensive lifestyle decrease the cardiovascular event? Actually, no. All the regime, it doesn't prove that it decreases the cardiovascular event. While statin, the anti-lipid, these statin, which decrease the production of the lipid by the liver, it causes decrease in the cardiovascular event. Where uses of statin, it causes decrease of cardiovascular event. For every 5 years, during 5 years, any decrease, it will decrease the percentage by 1% if you decrease the lower density lipoprotein by statin 2 milligram. And these drugs are safe, side effects are little, and even little is not dangerous, where it is well tolerable. How frequent side effect of statin occur? It is around 5% occur in those taking the statin. What are the side effects? These side effects of the statin is very, very important. You should know it. First of all, we took simvastatin. This drug is anti-lipid. It's very good actually, but it causes hepatocellular damage. Where if this happens, you should stop. You should stop this statin. Otherwise, you will get liver failure. And there is no treatment for liver failure except a new liver being taken by the patient. You bring a new liver, a donor for the liver for this patient. Therefore, this drug, simvastatin, they need to follow the liver function test every 10 days or 2 weeks. Any increase of the liver enzyme, the highest range, normally highest range, more than 2 to 3 times, you should stop this drug. Other side effects of all statin are fatigue. You should stop this statin. If the patient got fatigue, if he got weight loss, you should stop it. Whereas dangerous side effect is rhabdomyolysis, rhabdomyolysis. And this happened actually when a patient on statin and he took antifungal, azole, or he took cycloserine, cyclosporine, or even azithromycin. Another side effect is the difficulty to go to sleep, constipation, abdominal pain, myopathy. This is important. Joint pain, rash. All these can be seen in all antilipid. The 10th question: which vitamin in the nature is decreasing the lipid? It actually decreases triglyceride, decrease the low density lipoprotein, and moderately increase the high density lipoprotein, and moderately decrease lipoprotein cholesterol by 30%. This vitamin is nicotinic acid, but this vitamin should be given in a very high dose, and this high dose causing a lot of side effects. That's why this is intolerable. يعني it's not well tolerated because it causes a severe flush, and if you want to treat a flush, give aspirin. And the patient should also not take in spices and high temperature food. Question number 11: after acute MI, what is the level of lipid in the blood you should treat? Actually, in the acute phase of MI, the lipid increase. This is actually the trauma, and the body increase the lipid. Therefore, you shouldn't give anti-lipid unless it's very high during this period, acute phase of infarction. While after that, if the level of the lipid is 5 millimole and more, you should treat with statin. Question number 12: all regime. You will do regime. Then all these it is very important that decreasing the lipid after acute MI. Actually, this is not true. The severe regime is only decrease the lipid in the blood by 10% only. Therefore, you need statin. Statin is the main answer. What is the question number 13? What is the total lipid in the blood? Actually, it's between 650 to 750 milligram per del. Question number 14: what is the percentage of low density lipoprotein to high density lipoprotein? Low density lipoprotein is 3 to 4 times than high density lipoprotein. And remember, low density lipoprotein produced by liver and even though used for energy. And therefore, question 14: at which site in the body lipoprotein, LDL will be manufactured? It is in the liver. And this LDL or LDL cholesterol is the bad cholesterol. As we said, that the liver also produces triglyceride, and it produces all lipid in percentage. 85% of the body need, and 15% you need to take it from the food. While the high density lipoprotein actually is produced by burning the triglyceride for energy. Question number 15: where is the chylomicron produced? Where? In the intestine. Which antiplatelet that decrease the lipid? It's an important question. Actually, silostazole, which is a phosphodiesterase inhibitor, this silostazole decrease the lipid ويncrease the high density lipoprotein. It is antiplatelet. It's very good actually, and it has action, good but not moderate action on decreasing the lipid in the body. And thank you very much.